from the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
This week, infectious disease experts warned of a cold weather surge in new coronavirus cases. The long-feared second wave may be just weeks away. This as the death toll closes in on 190,000 lives lost in the last 6 months.
The long weekend stoked fears of another holiday surge in COVID, with packed beaches from California to Florida. As new cases continue to rise in at least 27 states, so does the pressure to find a viable vaccine, with America's toughest season just ahead.
And we're heading into the fall and the winter when we would expect a respiratory pathogen like a coronavirus to start spreading more aggressively.
On Face the Nation, former FDA Commissioner Scott Gottlieb says scientists will not be hindered by political pressure to expedite a vaccine before the election.
The likelihood that we're going to have a vaccine for widespread use in 2020 is extremely low. I think we need to think of that as largely a 2021 event.
But public confidence in a vaccine is another issue. A new CBS News poll shows Americans are growing more skeptical. Just 21% of voters in the United States say that they would take a vaccine as soon as possible. More than half say they would wait to see what happens, and another 21% say that they would never take a vaccine.
Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, COVID-19, a second wave. Here to talk more about the possibility is Dr. Adi Poor. Dr. Poor is the health director for the Douglas County Health Department. Thank you so much for being here. Welcome back.
Thanks, Kathy.
Before we do anything else, I want to take our viewers to the DHHS dashboard. And if you would be so kind as to walk us through what we're seeing there.
Sure. So this is the Douglas County Health Department website on douglascountyhealth.com. And it is probably one of the richest websites where people should go if they live in Douglas County. So it really, by zip code, it has a zip code map in there that will tell you, you can click on the zip code. It tells you how many people were tested, how many were ill, how many were covered. So you really can see it. On the bottom there, you can click on it and it kind of walks you through what happened over time. The bottom panel really talks about positivity rate, and you can see on there, we had a positivity rate up to 18% at one time, but you can also see at the end there how the positivity rate is declining. You see we have 178 deaths, and if you want to learn a little bit more about them, what is the percentage in the white population in regards to age or so on, we have 75% of our deaths that are 65 years and older. Above that, you see how many have recovered. We have potentially 75% of our cases that have recovered. On top, you see 14,545 cases as of yesterday. That's about 2.5% of our population here in Douglas County, and we have tested 140,323, potentially 25% of our population in Douglas County. So this website is pretty rich. We are adding on, we are right now working on it in putting some more data on it that may be of interest to the public. So it's a very good website because we were one of the first websites that had race and ethnicity on it. We wanted to be so clear and transparent with the public, and we have a wonderful GIS department at the county, and I have to give credit to them. They're really trying to improve it and trying to be as informational as they can be to the public.
Okay, and these numbers then September 14th, just to clarify for the viewers.
Correct. It always goes to midnight, and then the next day around 11 a.m. we actually update the data.
Okay, again. Okay, thank you. And Dr. Poor, given everything that you know, when you look at that data each morning, specifically this one, since this is the one we're talking about, what are you thinking? I mean, are we where we should be? I can't even imagine as a health director What thoughts are going through your mind?
You know, I get the data at 9 a.m. and I can tell you, Kathy, for all these months, I have never missed 9 a.m. I've always looked on my phone and waited till the data comes in. And the first thing I look at is, where are we with cases? How many new cases do we have? And so I can tell you, you know, this morning we had 75. Actually, over the last 3 days, they were always below 100. And that's kind of my goal now, is that we are below 100. But 4, 5, and 6 days ago, we were above 100. So then second I look at is, how many people have we tested? Because that tells me too, you know, what is the positivity rate for that day? Today was a little bit high, so that means people with symptoms potentially went and got tested, and not enough people just for surveillance purposes. So it's very insidious to me, but it's also very, to a certain degree, stressful, because you know, I would like to see that we have 10, 20 cases, and that's what it was in the beginning. That's what we had, and we were able to sit and discuss these cases with my team, and you know, we could make connections and so on. So I hope one of these days we are going to get back to that.
So with news then of phase 4 across much of Nebraska, before we talk about that, what does it mean really when we hear phase 4?
Yeah, you know, I think we need to be very careful not to put too much emphasis on it. What it really means, since we have gone through these different phases, it means that our economy is opening up again. Our restaurants, our gatherings are opening up. So the environment is opening up. Our behavior, however, should not change. So, you know, still wearing masks and all those things are still in place. But it means that restaurants now can open up full, but they should still seat people in regards to 5 or 8 people around the table. They should have tables apart. All the servants are wearing masks. So nothing should change on that, really. So really phase 4, of course, means everything that we had in place goes into guidance. And guidance is voluntary. And, you know, my concern, I think all our concern is, well, once it's voluntary, are people still following that? If you are a good businessman, however, I would say yes, you want your business, because what it does is it makes me go back there again. But if I see now they have dropped all of the precautions, I'm probably hesitant to go back there. So I would encourage, even though everything is in guidance, that we do not really change a lot. Some of the things that still will be in phase 1 are the gathering, 75% of the occupancy rate inside, and we still need to review plans in regards to gathering. So we'll do that, and we'll still hope all those precautions. And I tell you, we have had good compliance with the public in general. It has really been, we've been working with the zoo, with CHI Health Center downtown, and they have big gatherings coming up, but they have been very conscientious about how to do it. So I'm very proud of our citizens.
Very good. Now, most of the state moved to phase 4, not all of the state. Why?
You know, all of the states moved, all of the counties moved into phase 4 besides Lincoln-Lancaster. Lincoln-Lancaster has different regulations. They were an old health department. Old by old, I mean they were there a long time ago, and their regulations are therefore different. All the others, they are following, they need to follow what the state is recommending. And this is the DHM phase 4 is what the state is recommending at this time for everybody else.
You kind of hit on it, but given that so many people just want to get back to normal, that states like Nebraska are easing and lifting restrictions, and that we have our cooler months coming up, there has been talk of a second wave. How do you respond to that?
You know, potentially, as you have heard in the short clip there, there is potentially a higher risk in wintertime because we are going to be inside, and these respiratory viruses, that's when we really see much more transmission occurring at that time. I think we are so far into this, 7-8 months now. What I would like to say, we really need to protect those that are at highest risk. And that should be our goal. And then our other goal is, of course, to look at hospital availability and make sure that we are not overwhelming our hospitals. Those should be our two big goals. And therefore, wearing masks are going to help us all, and sanitizing areas where we are washing hands. Though stay home when we are sick. Those are things that are helpful. But I do think, I feel, as a community, we need to move on, we need to open up, but we open up by being conscientious about it, what we do as persons.
Okay, and we haven't even factored in the flu season, into all of this. You talked about protecting the older adults. So for those people who are concerned, especially with the cooler months coming, people kind of being trapped indoors a little bit more, and then you add to that the flu season, what would you tell those folks?
Especially it is important for those that are at high risk to get a flu shot. It's always our recommendation. Every year we recommend it. It's even more important this year. And because, the influenza is a respiratory illness too. So you potentially have similar symptoms. And I would just encourage all of individuals who are at high risk, older individuals living in long-term care facilities, that they go and get a flu shot as early as possible. We say usually in October, middle October. You should have the shot by the end of October. So it's even more important, and I hear VNA opened already a drive-through clinic this week or next week. So I think opportunities are here in this, and it's an easy shot to get. And so I would encourage everyone to get one.
Yeah, okay. And you mentioned masks before. Probably a good time for us to talk a little bit more about mask mandates. Of course, Omaha got through in an emergency ordinance, which was tough to get through, Dr. Poor. Briefly recap what transpired from the time that suggestion was made to the time that not only did we get it, but then it was extended.
Yeah, I always said from the beginning, when we saw what happened in Lincoln had the first mask mandate, and they really saw their cases decreasing. I felt it was really important that it was a tool that we were not using yet, we were recommending, and we still, I saw it in the community and I heard it. People were not wearing masks. So I said, I have the obligation to really try to do all we can to keep our community safe. But I always said that, I will only do it if I have the legal authority to, if the health department, the health director has the legal authority. And in the end, 2 days before we were going to put the mandate in place, the Attorney General as well as the Governor's office came forward with our city attorneys and said that they didn't think I had the local health department had the authority. And from then I stepped back, and fortunately we had the Omaha City Council then who stepped forward and has it in place. And I think it was the I get overwhelming emails from people who say, now I feel safe to go out. I feel safe to go to the store. I didn't feel safe before because I was the only one wearing a mask. Nobody around me was. So overall, I think it was the right thing to do for our community. I'm very thankful that we did it.
Okay, and we did then get that extension to October 20th. I'm curious, given that we're in mid-September now, Dr. Poor, what is your hope between now and then in terms of what we can see shake out with this virus because that mask mandate is going to be in place?
I actually already am seeing over the last 4 weeks, we are seeing a decrease in cases and a decrease in positivity rate. As a matter of fact, last week, our positivity rate was, I think, 7.4%. It was the lowest within 8 weeks that we had. Actually, when I was last on this program, Kathy, that's probably where we are now again. And we had this real peak in between, and we have come down from that again. So it looks very promising, but I always have to caution myself, not to get too optimistic, because this is not under my control. I mean, a virus I cannot control. I can only control to a certain degree some of the recommendations that we are making, but that's what I'm hoping. I've always said from the beginning, I hope a positivity rate below 5% would be something over longer periods of time, but also the case count needs to come down, not just the positivity rate, but cases, so that we have a small number of cases, we can identify those clusters, we can isolate them quickly, and it's not so much in the community and transmitted everywhere where we go. So that's my hope. But I don't know if by October, the middle of October, we are going to be there, or if it is going to take longer than that.
Yeah, time will tell. In addition to masks, there are other things that we can and should be doing right now. We have a graphic that we want to put up for our viewers. Walk us through some of these things that we can all be doing.
Well, those are good measures that you have there. I mean, 6 feet distancing, I always say that is so important when we are walking around. And I see a lot of markings everywhere in the stores that you go 6 feet apart. Wear a cloth mask, but wear it properly over your nose, not under your nose or so on. Stay home if you are sick. I think that is so important now when we are going into influenza season. If you have symptoms, I say to my staff all the time, if you feel sick, stay home. Don't think you are a hero coming to work. Wash your hands, use hand sanitizers if you cannot wash your hands. I think we all are used to have those hand sanitizers even in our cars. I have one in my car and use it every time I get in my car. Avoid touching your eyes, nose, and mouth. We say that during influenza season so often. Cover nose, mouth when sneezing, coughing. It's a little bit more difficult now when we are wearing our face mask or face covering, so to say, but still very, very important. You're not going to sneeze in your hand, I hope, or cough in your hand. Clean and disinfect frequently. I think we all learned how to do that at our workstations and so on. Clean our phones that we are using as often. So these are really common sense behavior that work. And they are not expensive. Everybody can do that, and that's really what we should be thinking about it. Kathy, it's really not so difficult. We really have not a lot of complaining to do. If these are the only measures, and these measures can make a difference, I think we all need to say, we live in a country and we should be very thankful that we have such a good life to live.
Yeah, agreed. Okay, so let's talk vaccine. There have been various reports out on a vaccine. Dr. Poor, how close are we really?
There are 3 vaccines that are in phase 3. And phase 3 is that phase where we look for safety and effectiveness. And just what I heard again today, they actually have close to 20,000 individuals already enrolled in one of the vaccines. And that is quite a bit more than what we usually have. For a usual vaccine, I think they probably bring about 5,000 people to a vaccine trial. So they are trying to have these huge trials so that they potentially can see quicker what are some of the side effects. And so, all of us who are in science, we are hoping that we are going to have transparency in data, that we have good data. However, what we do not know is what are some of the long-term effects. And so we hope those trials are going to go forward, 3. And I already heard that they are making vaccine at this time. Even so, they do not know, and they may say, well, this vaccine didn't work, and therefore we need to dispose of all of this. But that's how they are ramping up the time frame for it.
Yeah, and I know we don't have a crystal ball, but if you were to talk a little bit about the possibility of when everyone who wants a vaccine could have it. And how on earth, I mean, then we have to think about the delivery of it, but then who's first? I mean, how do you decide who's first?
So those discussions about priorities, they are going on right now as we speak. So the National Academy has put down a framework, kind of how they would look at priority groups. And they are looking, of course, as you can imagine, healthcare workers, emergency responders, individuals in long-term care, but they are also looking at potential priority groups for individuals who are, for example, in meatpacking, where the exposure, what we have learned from coronavirus, that they are more at higher risk in those environments. And so I think they are very thoughtful. They have it out for public comment and then are taking in the public comments and so on. So what I think may occur end of November, December, that there are small amounts of vaccines available for high-risk individuals. I would foresee that actually could happen. But for the larger general population, I don't think you have anything before spring, summer next year. That's when I would foresee we would see that. In regards to delivery, there are lots of plans going on right now. And my department also, we are planning how are we going to deliver, how are we going to deliver it fairly to everyone who wants to get vaccinated, you know. So we're talking about going into neighborhoods, trying to see what does it take, what are some of the barriers why people cannot come and get vaccinated. So do we need to go to them therefore? So those are big plans that are being developed right now, and I think by the time we have vaccine, we'll have some of these plans developed. Every day I have somebody who comes forward and say, we want to play a role in this. Wow. We want to help you. How can we assist to get this into the community? So I'm very hopeful that the delivery will occur. It will not be easy. Most of these vaccines that we know of now will require 2 doses. You know, potentially 2 to 4 weeks apart. So that will be a challenge again. How are we going to do that? How are we going to apply? They will need different cold storage chains, so to say. Some will be at room temperature, some will be refrigerated, and some are at deep zero, 70 degrees below zero. So this will be challenging, but I think we know about it and we know about the challenge, so we need to live up to that and say, how can we do this?
Okay, so as with the flu, there will be people who opt out of the vaccine. How would that impact the effectiveness of a vaccine for COVID-19?
Yeah, you know, and this is when we talk about herd immunity. If you have herd immunity, it doesn't mean so much if you are not vaccinated, because I have been vaccinated, I'm protecting you. But herd immunity means you need to have potentially 40 to 60% of the community vaccinated. That's a lot. You know, we have only, if you think back, and I was thinking about this morning, 2.5% of our community has had coronavirus at this time. 2.5%. We have a long ways to go. We need to vaccinate, if we need to vaccinate up to 40, 50% of our population. So, but on the other hand, if I am at risk, and I'm concerned about my health, I have underlying health issues, I may really want to take the vaccine. And you know, at this time, nobody has that opportunity.
Yeah.
So it will be much different, and that's why the mask mandate at this time and all these behaviors are so important, because that individual who is at high risk has no other option.
Yeah. You referenced this earlier, and that's our older adult, most vulnerable population. They have been behind closed doors for 6 months now. Given all they've been through in their lifetimes, all they've lived through, it really does hardly seem fair that they are still talking to people through the glass. What would you say is the light in the minutes we have remaining, just a couple, the light at the end of their tunnel? in trying to get back to some sort of normalcy?
You know, I actually had this discussion this morning. I just hope that some of the long-term care facilities have a thought outside the box and have said, for example, you can see your family by sitting outside in the garden and both of you wearing masks. So we need to think about it. How can we really make those connections again? I've seen a few pictures on Facebook where family members are now visiting their mom or dad and so on. So I do hope, and you know, long-term care is doing a lot of testing right now to really have this reopening occurring. So I'm hoping this is the end of that we are really trying to be able to see those elderly again, because they deserve it. They've had a hard life and a hard 6-8 months right now. And also the family members who want to see them, you know, it's on both sides. Yeah. So I'm thinking we are at the end of that. We really should start that communication again with them.
Okay. Thank you for that. All right, so for people wanting more information, COVID-19, a second wave, we want to put up some websites for folks. The CDC.gov, DHHS.ne.gov, there's some phone numbers there too, DouglasCountyHealth.com, and then NebraskaMed.com. Dr. Adipur, I want to thank you for being here today, for sharing your time and expertise, and for everything that you and your team are doing behind the scenes, in front of the cameras. You're amazing people. Please keep up the great work for all of us, okay?
I have a great team, and we want to do everything that we can for this community.
Thank you very much. As we close, a look at scenes from rural Saunders County as seen through the lens of Pat Cave, a junior at UNO. Thank you all for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at netnebraska.org/considerthis. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.